The transition between fourth year medical student and resident is crazy. Let me tell you, this is just one example, but I was going through research that I was supposed to present, a specific research study, a clinical trial that was run. And at this point, I'm going through the motions because as a fourth year medical student, there's so much research that you've presented, especially from like papers that you read. So I'm presenting to a room full of attendings, and it's going really well. And again, I'm just going through the motions because I've done this a bunch of times before. And then we get to the end and they hit me with like the most pertinent questions that they could possibly ask that threw me off guard. They said, okay, so now that you've presented the study, you're the doctor, I'm the patient, I bring you this clinical trial and I tell you, doctor, I read this online, will this work for me? Can you put me on this medication based on this clinical trial? You're the doctor, what are you gonna say? And I'm so used to thinking about this research as like, I look at all the like patient demographics and I look through the discussion and I think about the limitations and the, all the like generic data that you are so used to looking for as a medical student. But I have yet to, I haven't reached that point where I think, wait, I'm the physician. I am now deciding for my patient whether this is something I think they're going to benefit from, because my brain just hasn't switched into that mindset yet of I'm going to be a doctor in a couple of months. So I feel like I reached a new checkpoint today. And if you have already thought that way and you're not even a fourth year medical student going into being a resident yet, kudos to you, you're a step ahead.